Hello, my name is Crystal Schaefer. I'm a credentialed veterinary technologist with NOAA's animal hospitals and veterinary specialty emergency care facilities. I am also nationally certified in ALS and BLS techniques in canine and feline patients. Today, we are going to discuss, and I'm going to demonstrate for you, point of compression techniques, ventilation to compression ratios, including mouth to snout breathing, pulse points for return of spontaneous circulation while in the field, as well as hemorrhage control techniques, and compression bandaging. BLS, point of compression. There are two mechanisms of action that we need to be familiar with when performing BLS in the field. One is the cardiac pump theory, where the heart is the vessel pumping throughout the body, or the thoracic pump theory, where the chest becomes the pumping mechanism. With cardiac pump theory, it's going to be important that our point of compressions are directly over the heart. In a dog and a cat of any size, you can find the point of the heart rapidly by taking the top limb and pulling the arm back. Where the elbow meets the chest is generally the area of the apex of the heart and where point of compressions for cardiac pump theory are executed. When doing cardiac pump theory chest compressions in BLS, these are going to be reserved for animals that are approximately less than 20 pounds, like your smaller breed dogs and your cats, or it's going to be in animals that are considered keel-chested. Keel-chested animals are going to have their chest come to a point, similar to a greyhound, a whippet, or even your German Shepherd dogs. Thoracic pump theory is going to be the widest portion of the chest is acting as the compression point for compressions. With thoracic pump theory, you want to make sure that your chest compressions are executed over the widest portion of the chest. And quite simply put, when the animal is laying on its side, you look down, and where the chest is its widest is where you're going to begin your compressions. You're going to utilize the thoracic pump theory in your larger dogs and your larger chested breeds, such as your Newfoundlands, your Labrador Retrievers, your Pit Bull Terriers. Most 90% of your dogs are going to fall within this category. In the event that you cannot make a decision between cardiac pump theory or thoracic pump theory, err on the side of thoracic pump theory. In your barrel-chested dogs, such as your bulldogs, your mastiffs, you're going to treat them like you would a human in basic life support. They are going to be rolled onto their back, and the point of compression is going to be directly over the heart, directly over the sternum, and you're executing force utilizing the cardiac pump theory. When performing mouth to snout ventilations with your 30-point chest compressions to 2 ventilations, it's going to be important that you do not bring the dog or the cat to you for ventilations, but rather you go to the dog or cat, oftentimes laying your head directly on the ground. The reason why is if you bring the dog or cat to you for ventilations, you are actually cutting off the trachea and your ventilations or your breaths are being diverted directly into the stomach. Whereas, if you go directly to the dog or cat with your head to the ground, your breath is actually going into the trachea, into the lungs for proper ventilation. The first step when performing BLS in a dog or a cat is we need to remember that the way we position our bodies will give us appropriate leverage to displace the thorax or displace the chest by 1/3 to 1/2. That has become extremely important in the thoracic pump theory. We have to allow recoiling of the chest so that perfusion can continue to take place, and then back down we go to displace the thorax 1/3 to 1/2, recoil, displace, recoil. At the point of compression, we want to make sure that we're allowing ourselves enough force to be able to do that. We do that by making sure our shoulders are slightly over our hands and that we're getting enough force from our waist and not our upper body. Oftentimes this means that the patients need to be placed on the ground or at least at a level to where you can perform compressions by bending at the waist. When doing compressions, we're going to show the thoracic pump theory. I'm going to go at the widest portion of the chest on Casper. He's a Labrador Retriever. My right hand is going to go over my left, and I'm going to interlace my fingers to be able to use the heel of my hand as the point of compression. When I do these compressions, I'm going to do a ratio of 30 compressions to 2 breaths. And to recap, I'm going to go to Casper. I'm not going to bring him to me. I think it is important that when you're doing chest compressions, that you are actually counting out the number of chest compressions. That helps you stay focused on when the next set of ventilation is going to occur. When we're doing chest compressions, we want to make sure we're doing it at 100 to 120 beats per minute. Even if our compressions are perfect and our recoil is perfect, we are still only going to execute 30% of the blood volume. So the amount of chest compressions you do and the intensity of them are extremely important. A BLS cycle consists of 2 whole minutes, but when in the field, it's only 30 compressions to 2 breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then another set. Pulse points and return of spontaneous circulation. When you're in the field performing BLS, you do not have the equipment to let you know when you have reached return of spontaneous circulation. Rather, you're going to have to rely on pulse points. There are 2 main pulse points in dogs and cats that you can utilize easily to let you know if you return to spontaneous circulation. The first pulse point is the apex beat. Just like the name implies, the apex is the heart, and you are literally putting your hands on the chest at the area of the heart, and if you remember from BLS compressions, we pull the elbow back, and where the point of the elbow meets on the chest is where the apex of the heart is going to be located. That is where the apex beat can be felt. The second pulse point in dogs and cats are going to be the femoral pulses. Each dog and cat has a vein, the femoral vein, that runs just inside the leg of a dog and a cat. When return of spontaneous circulation occurs, you can oftentimes reach your hands into the inguinal aspect or the deep inner thigh of the dog and the cat to where you can feel the pulse. Hemorrhage. Sometimes in the field, you're going to run into a situation where a dog or cat is hemorrhaging or is experiencing acute blood loss. If there is concern about blood loss in a patient, there are a few simple steps that you will need to take. The first step is to apply your ABC triage. We want to make sure that the patient is breathing and we have pulses. Once it has been determined that we have pulses and our patient is breathing, you're going to want to apply oxygen via face mask to the patient. Once oxygen is being delivered to your patient, you're going to want to focus on hemorrhaging points to help slow down or retard the point of hemorrhage. Oftentimes, hemorrhage takes place on the limbs of our animal patients. It's going to be important to note that anytime you're controlling hemorrhage, you're going to want to go above or proximal to the point of hemorrhage to occlude and slow down the bleeding, just like in a person. What you can use and what the ideal situation is that you can use an oscilliometric blood pressure cuff, pump it up, and occlude above the point of hemorrhage. Blood pressure cuffs are safer because they supply an even distribution of compression and is less likely to cause nerve damage in these patients. If a blood pressure cuff is not available, you can use a tourniquet like you would in a human. We can also use compression bandages, which we can talk about next. Bandaging techniques. To apply a bandage, you will need rolled cotton, you will need rolled gauze, and you will need some type of barrier dressing. This can be elasticon, this is called vet wrap, or anything that can cover the outside of the bandage. The first thing you're going to want to do is you're going to want to make sure that the toes are covered. You cover the toes by putting the bandaging material at the tip of the toe, and you're going to roll it around until the toes are covered. And then you're going to work your way up the leg, making sure that each layer is 50% covered by the second layer. So half of what I put down is covered, and I'm working my way up the limb, making sure 50% coverage is occurring. When placing bandages for hemorrhage reasons, it's going to be important that you have enough rolled cotton to act as somewhat of a compression. So you can achieve that by applying minimally 2 rolls of cotton. It's not uncommon to have to apply 4 rolls. You're going to apply the rolls based upon how bad the bleeding is. This bandage does not have to be perfect. It just needs to be able to do its job until you can reach a Noah's Animal Hospital. After your rolled cotton has been applied, you're next going to apply your rolled gauze. The same fashion and same technique applies as with the rolled cotton. Again, starting at the toes and working your way around, and you're going to work it the exact same way you did with the rolled cotton, working up the leg and covering 50% of the layer previous. The only difference is with the rolled gauze, you're going to tug slightly as you're applying it. This will provide the compression that you need to help control hemorrhage. Once your rolled your rolled gauze is complete, you're going to add your final layer. This is your protective layer. Worst case scenario, if you do not have a protective layer, that's okay. This will suffice until you get to a Noah's Animal Hospital. If you have a protective layer, you're going to apply it in the same fashion that you apply the rest of the bandage, starting at the toes, and then working your way up the limb, covering 50% of the layer laid down before it. There you have a compression bandage. I'd like to thank you for joining Casper and I in learning basic life support, compression point techniques, ventilation ratios, control of hemorrhaging, and bandaging techniques for in the field. If you have any questions or seek clarification, please feel free to contact me.